emerging psychiatric service users movement in East Africa, the struggles, challenges, successes, and the gaps with specific references to issues of concern to people and families with mental illnesses in the region.
The recent history has seen the establishment and founding of disability movements from the global disability movements, continental, regional, national, and even much lower levels. This was in a bid to ensure that persons with disabilities are involved in charting their own destiny. It started with umbrella organizations, but the recent past has seen the emergence of disability category-specific organizations. This has also followed the global, continental, national, and district arrangements. Along the same lines, the psychiatric movement began to shape and started organizing in the East African region with organizations of persons with mental disability, starting in Uganda, Kenya, Rwanda, and Tanzania. These started at different times, and this has also reflected in their current levels of development. Mental Health Uganda started in 1997 to bring together people with mental illnesses and their caregivers to make a united voice, focusing on service improvement.
Mental Health Uganda is an organization that brings together people that have suffered from mental illness. It's operating in all regions of the country in now over 23 districts. Mental Health Uganda, before it started, there are many challenges.
23 branches spread in all parts of the country. By 1997, Uganda, with a population of close to 22.3 million people, had only 7 psychiatrists, the majority of whom were administrators.
So on average, I have about between 780 patients. Sometimes I go up to 800. Way beyond what I should be handling, because I should be handling about 600 patients. So I have over 120% occupancy.
With very inconsistent mental health supplies and with no semblance of a holistic mental care. This, though still be found in some places, has considerably reduced where Mental Health Uganda operates. Psychiatric users were treated with no respect and concern. It was common to have them lynched in communities by mob justice.
That same night I was admitted, and I started wandering in the hospital compound. By then I was intoxicated with the drugs because a lot of drugs were given to me. I was injected and others were given. I was virtually moving while sleeping. I became a sleepwalker, if I can say. And the guards pounded on me. They beat me almost to coma. I lost 2 of my front teeth, and realizing that I was putting no defense and I was getting weaker and weaker, they dragged me to Central Police, and that was where I spent the night.
MHU was the launchpad for the continental Pan-African networks of users and survivors of psychiatry in Kampala in 2004. Currently a full member of the National Union of Persons with Disability, Mental Health Uganda is now a very active member of various policy and legislative institutions, influencing forums in the national disability movement.
We have registered members of users and the guardians. And these brands, I want to inform you that is very active.
The realization of the reflection of mental health rights in many upcoming pieces of legislations, including the Disability Act. Using drama and other innovative approaches like drama for mental health, the media, partnership and coalition building, MHU has educated communities to change attitudes and stigma mental health, seeking behavioral change in its catchment communities. While instituting its mandate, Mental Health Uganda still views that Uganda as a nation still has challenges with dealing with mental health care. And these include limited knowledge on mental health and mental health rights, Stigma is still widespread, which leads to very negative community practices. There is still rampant violation of the rights of persons with mental disabilities, limited coverage with still many areas yet to be served. The Ministry of Health in Uganda, recognizing the role of MHU in community mobilization for mental health promotion, invited Mental Health Uganda to open up branches in all districts. Widespread mental health right violation. The very old 1938, last reviewed in 1964 Mental Treatment Act. Limited interest in mental health as an area, not a priority to many current development programs. However, the way forwards include the need for intensified mental health education in communities, focusing on the most relevant stakeholders in the community.
We have advocated for inclusion in poverty reduction initiatives in the country, for instance, NADS, NUSAF, PRDP, and other both government and non-governmental poverty reduction initiatives. We have done a lot of community mental sensitization to raise the awareness of the community. Many times people abuse rights, or even people act inhumanely towards people that have suffered from mental illness because of what they don't know about mental health. So if our sensitization has worked quite a lot to even change, to reduce the stigma, to reduce discrimination of users of psychiatric services, and so on. We have done income generation projects to promote user economic rights at household level and also at individual level. We have advocated through the user movement in Uganda to have some of our members included in some of these programs.
Health rights promotion using effective community-friendly approaches like domestication of major violation human rights instruments. Continue influencing relevant legislative and policy reforms. And finally, there is a need to make a case for and attract more agencies to the field of mental health in the region. There was widespread and unchecked stigma and discrimination of persons with mental illnesses, and users lived a lonely, very stigmatized life, hidden in many homes for fear of homes being stigmatized. The very mental health professionals were stigmatized, even in training institutions, with students fearing to be stigmatized if they took mental health courses. Traditional and spiritual healers treated patients with mental illnesses with very limited monitoring whatsoever. Mental health drugs were very expensive and served in very poor backyard structures in many government hospitals. There was widespread of lack of basic information and knowledge about very basic facts about mental health. For instance, the widespread thinking that mental illnesses is demonic caused many to seek for treatment in traditional shrines or churches for exorcism. Mental Health Uganda started in 1997 and mobilized people with mental illnesses with their caregivers, and have since then worked using the user-led model to influence and have a positive influence of both professional and community practices when handling psychiatric users in parts where its branches are situated. Combining both demonstrable learning service provisions like through drug banks and support to livelihood programs among its memberships and the largely advocacy model, MHU has been able to influence attitudes and practices, though looking at the vastness of both the need and the width of the country.
We could have projects that are internally funded and therefore more sustainable. We need to have users of psychiatric services be able to themselves support each other and support their own initiatives. Now, part of the challenge is again the limited personnel. We can talk of the 34 psychiatrists in the country, but these are a drop in the ocean still. You have regional hospitals, you have districts, regional hospitals without psychiatrists, and districts that miss quite a number of other related mental health service providers. We need to have more awareness done within the community. We have many users whose rights are abused in the community mainly because of what the community does not know about the rights of our members. And therefore, you end up having people abusing rights without knowledge. And even the very people whose rights are abused sometimes do not know their rights, and therefore they cannot claim them. So in order for us to protect rights, we need to have a user who is very much aware of his or her rights, but also we need to have a community that therefore, after knowing the rights, then can promote and respect them. So we still have a gap there. We still have to domesticate many laws, like for instance the convention that Uganda ratified. We have to have this convention translated and make sure that people understand what is in this law, in this convention, other than having this document which is in English and is still a bit far away from the community. We still have issues to do with user involvement in ongoing poverty reduction initiatives. We have NADS, we have NUSAF, we have PRDP, we have all sorts of income promoting agencies in the country, SACCOs, but we still have many users of psychiatric services excluded from all these initiatives. Yet they are intended for the poorest of the poor. So we need to have more users involved or mainstreamed in all these, included in all these poverty reduction initiatives that are in all parts of the country.
While instituting its mandate, Mental Health Uganda still views that Uganda as a nation still has challenges with dealing with mental health care. And these include limited knowledge on mental health and mental health rights,
divorce, separations that is engineered because of the bad attitude people have, and then the right for them to enjoy their families, like children. Some mothers, their children have been taken away from them just because it is known that they have suffered from mental illness. They just take away their children.
Stigma is still widespread, which leads to very negative community practices. There is still rampant violation of the rights of persons with mental disabilities.
Even these cultural and religious beliefs are misleading us. Another thing that is misleading us, that should be banned immediately, are the Nigerian films. The Nigerian films show that somebody who has done bad, then the gods get annoyed, then he runs mad, then he removes his clothes. So everybody gets it in their subconscious that people who are suffering from mental illness did something bad. It just happens in the subconscious.
Limited coverage, with still many areas yet to be served. The Ministry of Health in Uganda, recognizing the role of MHU in community mobilization for mental health promotion, invited Mental Health Uganda to open up branches in all districts. Widespread mental health right violation.
I remember, recently, I've just been sharing with colleagues, there's a client whom I've sent to Utavika Hospital. It's a forensic case. He killed his own mother. Even now, if you went there, he'll tell you, I killed my mother. He has schizophrenia. Recently, the RDC recommends that he should be brought to our unit. And police goes to the village and brings him. He had padlocks all over himself. In other words, there were so many on hands and legs with manacles. He could not move. He had wounds all over. When police just came and dumped him at the gate of the unit. And I asked them, where is the urgency order? They could not produce it. They said later. After 2 weeks, they would not even bring it. So they just reached there. They could not even watch whether we injected him. They simply walked away, jumped on their pickup and went.
The very old 1938, last reviewed in 1964 Mental Treatment Act. Limited interest in mental health as an area, not a priority to many current development programs.
To raise awareness on users' rights, we need to engage key stakeholders in mental health rights, for instance, the police, security agencies, the banks, the justice sector, the roads sector, education, employees, people involved in development programs. The mental health workers themselves sometimes can abuse rights as they treat our members. People in development programs deny our members their development rights, the economic and involvement rates. We have the community that of recent has had to engage in a lot of mob justice towards people with mental illness in many parts of the country, as it can be observed in the media. The media itself, the media fraternity needs to be engaged more, because while it's a very good agency in promoting mental health, once they know about them and they are convinced they should promote them, but they can also be a very negative mental health rights agency in terms of promoting them. Sometimes they promote stigma, given the words they use, the references they make about mental health and people with mental illness can sometimes be quite damaging.
The widespread rights violation calls for the need to focus more on the mental health rights promotion, using effective community-friendly approaches like domestication of major violation human rights instruments. Continue influencing relevant legislative and policy reforms. However, the way forwards include the need for intensified mental health education in communities, focusing on the most relevant stakeholders in the community. The need to promote innovative ways to fight mental health-related stigma.
To counsel other fellow patients, it will find, but we are doing it from an ignorant point of view, and many times you'll find that is when we give on every clinic day, you'll find one of us goes to give a health talk.
The Psychiatric Service Users Movement in Uganda is a true reflection of the situation of other similar user movements in other countries of East Africa. While they have succeeded in a number of areas, the challenges remain enormous.